This procedure video will take you through the techniques of inserting a surgical chest drain. This procedure has occurred in the MK Mosque examinations previously and could well appear again, both as a procedure in itself or as teaching a medical student how to conduct a procedure, as well as the indications for a chest drain. As in all procedures, marks will certainly be awarded for a good introduction, a thorough explanation of the procedure, and the obtaining of verbal consent. Take time now to familiarise yourself with the equipment required, and remember that universal precautions are required at all times, including hand washing and donning of gowns and gloves.
Right, so I'm going to insert the chest drain. So I'm going to first locate the site that I want to put it into, which is the fourth or fifth intercostal space. And I can find the fifth rib by feeling for the sternal angle, finding the second rib, and then counting down and following that rib round. And the fifth rib is usually around about the level of the nipple. And I want to insert the drain just anterior to the mid-axillary line. I'm going to say here. And clean the area with some antiseptic cleaning solution. I'm going to clean a nice big area. And then I'm going to drape the area to make it sterile. I'm going to infiltrate with some local anaesthetic. So I'm just going to double check my position. And then I'm going to insert the needle for the local anaesthetic. I'm going to feel for a rib. I'm going to insert it to the top of that rib. Go down onto the top of the rib. Aspirate and infiltrate underneath the skin. Down onto the rib. And then walk my way over the top. I'm going to aspirate, infiltrate. Infiltrate all the way up. Back down. Aspirate until I'm through the pleura. You can tell by bubbles. And then aspirate all the way out. And for a surgical chest drain, I'm going to make sure I infiltrate subcutaneously along the line of the incision that I'm going to make. In the same position that I've infiltrated local anaesthetic into, I'm then going to make an incision along the line of the top edge of the rib, about a finger width in length. And then I'm going to blunt dissect down by spreading first one way, turning 90 degrees, and then spreading next. I'm going to keep pressure applied, holding on to the clamp near the skin so that I can't go through too deep. And I'm going to go down until I feel the pop through the pleura. And I'm going to expand the hole. Make sure I've got a good tract. I'm going to ease the clamp out whilst I ease my finger through the same hole. Once I've got my finger through the pleura, I'm going to do a sweep on the inside of the chest wall to check that there's no adherent lung.